Hi everyone, today I will introduce my final paper for current issues in Aging Services Management class. I discussed the chronic care model and the long-term care model for older adults in community care. We noticed that the elderly population is rapidly increasing and the long-term decline in fertility. This influenced the shortage of the workforce in aging services. The Center for Disease Control and Prevention reports that elderly adults who have one kind of chronic disease are 80% of the elderly population. Chronic disease lasts more than 1 year and need long-term care. Some research report that many patients might live in community in the next 5 years. The community care, which offers primary medical personal care services in their home, will be the crucial part of the future care model. There are two new care models of community care, chronic care model and a long-term care model. The chronic care model composed of 6 parts. Patient self-management provide self-management training to patients, helping them to establish a good relationship with caregivers and doctors and offering education to patients. Delivery system design is on the basis of patient self-management and it emphasizes the cooperation of a multidisciplinary clinical team. It can provide control of disease guidance to patients. Clinical decision support provides proof which was related to clinical physicians so that the medical decision and the care of patients can be developed. It might promote communications between general medical physicians and specialist physician. Clinical information system are electronic medical collection of patients' registry and medical records that report the patient's individual clinical conditions. These records are presented to patients and their care providers. Community resources connect patients to the organizations. After organizations accept the customer requirements, they will find the different companies who might offer the services to make the care with continuum. Healthcare organization is required to promote the development and improvement the chronic care model. Long-term care is developed in different model, and the community development model naturally occurring retirement communities shows us the combination of formal and informal home and community services. The term NORC, coined in 1984 by Michael Hunt, does any geography define the community in which at least 40% of the population is 60 years old or older and live in their own homes. My conclusion is that the chronic care model should be widely used, especially in the community care system. Patients' education can be a more effective way to improve their self-management level. Completing the delivery system design and combining with the clinical information system, and then use the community resources and the clinical decision support. Even every healthcare organization should establish cooperation with each other so that they might be the reformer who promote the process and innovation of the chronic model and long-term care model in community care. For the long-term care, NORC is one way to support successful aging for seniors, especially after elderly people retire. Thank you very much.